This is at Memorial Hospital. Let's just introduce to you Director of Knowledge Transfer, which is Andrew Paul. Thank you. Sorry for the big start. Thank you for your patience. So I just wanted to let you know that Shak is actually the brainchild of Advocacy, who's located on the flyer. She was originated in the birth in 2011 from the Sickle Cell. She started the organization January 2016 while the 10 months. And in August of that year, she lost her battle. So our mission really is educating parents and support those living with sickle cell here in Florida. So we partner with at Memorial this every quarter so that we can teach each other and support each other and how we can support the community. So I'm so happy to have Dr. O here today, one of my favorite people. And I wanted to, I'm also very happy to introduce you to Denise Frankfurt, who is one of our moderators. She's going to be on our panel today. And Zoe Chinmoy, she is a caregiver of a daughter who is not here, but she came all the way from country, right? And I just wanted to thank you all for coming. Arlene Lewis Marr, she's a board member, and she's going to be our moderator for today. We have some goodies back there. She just came in with some pants as well. She's putting them up shortly. So please yourself and enjoy. The purpose of this discussion: advocacy, access, and accountability. Can we have the panelists up here, please? One of the struggles with sickle cell is that sometimes things happen unexpectedly. So there was supposed to be another patient, but he was admitted. So yes, it just happened. I'm going to ask you each to introduce yourself. Just a little bit about you all.
Good evening, everyone. My name is Dr. Joy Green-Chalet. I am the medical director of Memorial Sickle Cell Medical Home. I grew up in Greenville, South Carolina, and I moved to South Florida about 3 years ago to take a position here. The reason why I decided to do sickle cell disease for my career is because a lot of my family members have sickle cell disease, and one of my family members came to visit me during my last years of medical training and had like a just really bad crises. And at that point, I realized I was on the brink of being a doctor and had completed all my medical education, but did not know how to help her. You know, I had a little bit more time left, so I went and I sought out a mentor who did sickle cell disease and just fell in love with it. I felt it was a mesh of who I was, thinking about the way I grew up, and knowing that, you know, especially for adults, since that's what I specialize in, that the care was very abysmal, and I wanted to change that. I really wanted to make sure that at the end of my medical career, I could look back and said that, you know, God, I did something good. So that's me. Yeah.
Hi, you guys. My name is Zoe Chinmoy, and I am a caregiver to my 16-year-old daughter, Aaliyah Chinmoy, who's not here because she had a bad attitude, so I left that negativity at home. So we don't want that in Island Space tonight. You know, just like sickle cell disease, teenagers can be unpredictable, and I rebuke it. So she's back home, but I am a caregiver, and that's why I'm here today.
Good evening, everyone. I'm Denise Rainford. I'm a mom. You don't hear me?
There you go. Oh, it's
Good evening, everyone. Oh, this is much better. I'm Denise Rainford. I'm a mom of two beautiful children. I'm a wife also. I'm a sickle cell warrior and advocate. On TikTok, my page is Miss Flamboyant. I talk a lot about sickle cell disease every chance I get, in every space I get. I'm a volunteer for Shak School. I'm also an employee of FSCDR as a communication consumer specialist. So I'm just here tonight to share my views on sickle cell as always. And thank you guys for also having me.
Just a reminder that Memorial is our sponsor for today. So please visit their booth when you're through. Just a little discussion on what happened, or how you deal with everybody, or how you deal with a sickle cell person, a warrior. You can just give us a brief what is it now? Life in as a sickle cell warrior, how you would deal with that person when they're in a crisis and all of that.
Okay. I can go first from the medical perspective. So, the life of a sickle cell warrior is very tough. I think it's tough globally, but also in the U.S. too. Thinking, like I said, with the medical knowledge and education that's lacking. So a lot of times, I think when we think about the health and the treatments we have, it is a result of the neglect of sickle cell disease, just globally and stuff of that nature. So, has someone who specializes in sickle cell disease, you really have to seek out other medical communities. There's a lot of national communities of quote unquote experts in sickle cell disease that I'm a part of and research too as well. But I think the main thing that when you are caring for adults with sickle cell disease is compassion, knowing that the day-to-day can be very hard, and knowing that the pain that they have is something that kind of plagues them. It doesn't. A lot of our warriors thrive with it and are able to function and things of that nature, but it's something that you really have to, at the beginning, you have to address in some way or manner. Other things that is important is that you kind of look at the whole picture too as well. There's a lot of social determinants of health. There's issues with transportation. There's issues with insurance. All of those things are important too as well. So when we look at the care of someone with sickle cell disease, we really want it to be comprehensive and holistic. So that's also important too as well. And then lastly, even though, like I said, the medical research is lacking, what's out there, it is important that evidence-based care is given. I don't think anyone should receive anything less. So we want to make sure that that's done too as well.
What was the question? I was really lost in it. Like dealing with someone that has a crisis.
Right, we want to deal with advocacy during the crisis.
Yeah, so for me, whenever my daughter has a crisis, it's just fully believing anything she says. A lot of times kids will be like, "Oh, this hurts, this hurts," and do you know if they're telling the truth? Who knows? But with my daughter, with her sickle cell, because I have a lot of kids. I have 3, which is a lot in this economy. but with her, anything she says, I instantly believe, which who knows really what the case is, but I always believe her. And I always take her to the hospital or do whatever, accommodate her needs. Because I with my research, I have seen and realized that a lot of times people go unheard, and I just can't be a part of that, So I always believe anything she says. I also journal anything that she has. And yeah, I just do the best I can. Yeah, that's it.
Okay. So from my perspective, living with sickle cell disease for over 50 years, It's a bit a roller coaster because sickle cell disease affects you physically, mentally, emotionally, psychologically. And a lot of persons don't think that since we look so well, yeah, and young, thank you. So we are not in pain. And I say all the time, you cannot see pain. I don't want to look like what I'm going through. So I try to look my best at all times. When I look good, I feel good. So this is really what a lot of persons misinterpret when they see a lot of warriors that, you look so good, you're not in pain, you don't look like you're sick. But deep down, we want to look our best. And sometimes we put the best outside, but inside we are tearing up. So that's just how I feel.
How do you navigate through your pain while in the hospital? You know the doctors and the nurses what they're feeling or what they're doing. How do you navigate through all of that?
I've not, thank God, I've not been in the hospital since 3 years now.
Wow.
Yeah, because I'm on medication, so I've not been admitted. But when I used to be admitted, I used to advocate for myself. I used to tell the doctors, this is what best works for me. Because I think that as a medical personnel, I'm the one who is dealing with the illness more on a personal basis. So it's best you can listen to me. It's good that the doctor knows what to give me, when to give me, but when I tell you that, for instance, I may say morphine does not work for me, and you still insist to give me morphine, then the pain will linger on. So I try to advocate for myself in a way that they will understand me, in a way that the discussion is not harsh, because sometimes when you're in pain and you're not being attended to, sometimes it can come up that you're getting, a bit, edgy. But I try to be patient, even though I'm in pain, and I tell them exactly what's best for me. And sometimes they listen, sometimes they don't. But at the end of the day, we work together as a team effort.
Do you?
Yeah, I mean, same. I advocate for my daughter. A lot of times, I mean, I've been to hospital and they're like, "Oh, how long has she had sickle cell?" And I'm like, "Okay, I see what's going on here. I'm sure you've gotten that. It's like, okay,
Yeah.
I'm gonna have to walk you through this right now." But yeah, it's definitely been a struggle, but advocating, making sure that my daughter is not being pushed to the side, and I'm also teaching her because she's also 16 now. So teaching her to speak up for herself and letting her know this medication doesn't work for me. This one does work for me, and also just feeling her best. When you look good, like you said, So even when she's in the hospital, I do her hair or whatever, just so that she can feel better, put her in a better mind space. But yeah, that's it.
I can tell you, Shakira made herself always look pretty, and her mother will tell everybody that she was a careless mother at that time because Shakira wanted to see Beyonce. So she told her mother, "Go get me this and get me that. I'm going to the Beyonce concert tonight."
Yeah.
She broke out of the hospital.
Queen.
Yeah.
Okay, yeah, but I'm
I understand what you're talking about.
Yeah.
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 Okay. Any barriers to access and what has helped? Any barriers that you have all been through?
In what in elaborate a little bit on that.
In healthcare, if you have to jump hoops. Jump?
Yeah, I can say from what we see, but then I would like to hear what you guys have heard too as well.
Barriers in healthcare. I think the barrier that I've experienced is the stigma sometimes that come along with having sickle cell disease. Just like any other chronic illness, I think it comes with a level of stigma. And sad to say, a lot of us may not experience it. Some of us may experience it more than some, but that is the greatest barrier for me because when you go in the emergency, it's like sometimes I've not really experienced it a lot though, but sometimes it seems like You're picking if you're in pain or you're not in pain. Do you look like you're in pain? Are you in a severe, how much? I don't think you're a 9. I don't think you're a 7. So I think the stigma that comes with it, that is the greatest barrier for me.
Yeah, I want to touch on that as well. With my daughter being more on she's almost an adult now, and she's 5'9", like 210. I can still cuss her out. But with her being, more on the adult side, it's really hard to remember that she is still a child. And just speaking up for her, like, oh, I've had like people deal with her rough in a way that they shouldn't even deal with an adult, much as a child. So that situation has arisen as well. And then also her own barriers that she set for herself because she's very afraid with her research, becoming addicted to medication. She's afraid of even treating her own pain. So that's a whole struggle in itself. And then like now she's paranoid of feeling like a certain way. Is the medicine making me like just the anxiety and the stress that comes with just treating herself? And I'm like, having a baby, you're like, look, listen, lean into the medication, just relax. And then finally seeing her doze off, it's just the nicest thing ever. But it's just such a struggle with her own paranoias of, being addicted, so yeah, those barriers are rough. And especially, because the whole stigma, so she's trying not to be a part of that. And then in return, she doesn't want to treat herself. So yeah, it's rough, but we're getting through it, and she's now realizing how the medication can help her. And I feel like we're finally crossing that, like, that barrier.
Yes.
Because this is a space that we talk about a lot, if someone is taking meds, like, for 20, because it's acute, I'm trying to it needs not okay.
Yeah.
But I find it interesting and it's of your take on that, that somebody is afraid. Like that they're young, but you're afraid of it. So they cool, I mean, as a counter.
Yeah. No, I actually do see that. Pain medications are very complex, and it's something that is needed for acute crises. And a lot of our warriors will develop chronic pain, and pain medications are a part of that management too as well. But when we are developing chronic pain, the most important thing is that we're looking more holistically, right? So pain meds are only a part of the treatment paradigm that we're going to use. So some of that is just kind of lifestyle changes that we want to focus on. You want to focus on sickle cell disease, at making sure that some of the disease modifying therapies, sometimes hydroxyurea is helpful, that we're using that first too as well, because that's something that can prevent crisis, hence prevent acute crisis, and then acute crisis and develop to chronic pain. So that would break that cycle too as well. So I think as long as we are addressing things holistically, I don't think it's fair for anybody to carry that stress. And it was very insightful to hear that. So I think these conversations do need to be discussed between the provider and the patient.
I will say, with my daughter, it took us years to get her finally on hydroxyurea. Now she's on it, and so far it's been great. But she just started it maybe like 6 months ago, and she's 16. So we went our whole life without daily medication, and now that she's on it, it's been, life changing so far. So we hope it continues. But
and can I say something about hydroxyurea? Because I'm very passionate about hydroxyurea. Everywhere I go, I talk about it. Honestly, I've never felt this good.
Oh wow.
In 47 years.
Wow. Wow.
Yes, 3 years, the 21st of February, I've not been in the hospital.
Wow.
And I get very emotional when I talk about it because sometimes on a yearly basis, I'm admitted 3-4 times.
Right.
And it has been 3 years. So when I talk about hydroxyurea, I know that it may not work for everyone, but it's worth a try. It's worth a try. I told a friend of mine yesterday, I said, listen, it's worth a try because what if it do work? She said it may not work. It's just like anything else. It's just like a relationship. You can go in a relationship and you get married and you work, or you get divorced, don't work. But you have to try, right?
And my daughter was on the pill form, and she developed like a crazy reaction. And then another barrier that we had to deal with was insurance, because they were like, okay, well, this didn't work. She developed crazy like rashing, and her fingers were swollen. And then they put her on the liquid form. It was like $3,000 a month, like crazy. And then finally, after going back and forth with insurance, she got approved, and now the liquid form has been working amazing for her, and it's been great. It's been great.
Yeah, I would say insurance is a major barrier, especially for adults with sickle cell disease. And then, fortunately, changes with the healthcare that may be coming down the line with the change too. So we've already seen some of the effects at Memorial. Other things that are barriers are getting these therapies, kind of like what you said. So the hydroxyurea, the capsule form, is relatively cheap and inexpensive, but again, some people have issues with taking pills. So the liquid form is so helpful, and it used to be not expensive, but then the company patented it this past year, so now it is expensive. So it like really makes me mad because because back in the day, all the pharmacies could compound it within their own location. So they didn't, they took the capsules and made it into liquid, but now that is patented. No pharmacies can do that any longer. And then there's another formulation called Sickle, which is a disposable tablet too as well, to kind of help with those barriers. I think another barrier, like I said, in terms of disease modifying therapies, there's probably about 5. And then when we look at cystic fibrosis, which is another genetic disease, they have around 30, 35. So, as a physician, that's hard to work with. Especially once we know that some of these drugs can actually, like we said, prevent the crises, hence prevent pain, and have people looking like Denise here, a beautiful decision. So, exactly. Yeah. So cystic fibrosis is a genetic condition that predominantly affects Caucasians in the U.S. In terms of like the history of cystic fibrosis compared to sickle cell disease was discovered much earlier, I think in 1917, correct? And then cystic fibrosis was maybe in the 60s. But when we compare the research dollars, the medications, it's just, it's sad. So I believe the slide that I usually show is that the research dollars that goes to, and I can't remember the exact numbers, but it's on the level of maybe $2 goes to sickle cell disease versus 250 is going to cystic fibrosis. Another thing with cystic fibrosis, when we think about access to care, they do have a program that that basically provides care for their cystic fibrosis adults throughout their adulthood. So the issue that I get when people are transitioning from pediatrics to adults and or if they turn 26 and there's a lack of insurance and hence they can't see me and they're going into the ED, that's non-existent for cystic fibrosis. And then again, the difference between the treatments that actually work, 35 versus 5 that we have. But there's still hope. We have transformative therapies. We have transplant gene therapy too that I'm very excited about. It's relatively new. It's relatively expensive, but this is a starting spot for us, a starting place. And I'm really excited to see what will happen.
I'm going to ask for the caregiver perspective, and that's you want to enlighten us a little bit more. I mean, you've spoken about it already, but is there anything else you wanted to
add? Specifically on what though? Like,
well, you did the advocacy, but you advocate for your daughter when she goes to the hospital.
Yeah.
But when she's at school, how does that work?
A lot of nagging her, a lot of did you drink your water, don't do too much when you're, running around so it's a lot of things that, I keep bringing up teenager, but that's where I am right now with her. A lot of things that teenagers don't necessarily want. They, and I still struggle with the, with raising a teenager by itself and then raising a teenager with sickle cell and trying to find that balance of, am I being too harsh? Am I being too strict on her? Is she gonna have a crisis if I yell at her? And a lot of problems right now that, I mean, I'm looking for answers if anyone after this can guide me, is that every time that she's had a crisis, a bad crisis in the last 2 years, it's been after me and her have had an argument. So I deal with the guilt for like, it's beating me down bad. The guilt is there. And then on top of it, it's like, should I just let this girl go and do her thing? Or should I deal with her how I would normally deal with a child, you know? So there's that. Also dealing with my sickle cell child and then my children that don't have diseases and explaining to them what's going on. That's also been its own issue as well. But yeah, that's definitely the thing that I struggle with most is discipline, because teenagers are very willful and rude and disrespectful. So it's been real interesting, sparing the belt with her, because I really can't discipline her the way I want to. But then, a lot of the outsiders, which it's hard to even listen to friends that don't have kids in this situation, but my friends are like, you can't spare her because the world is hard. So, but at the same time, it's my baby, it's my first child. This is my everything. So it's I would love to hear what you're going to say. So my eldest is 16, as I said, and then my middle is 11 and my son is 7. So, and it feels like 20 years in between each child, honestly. Like my daughter that's 16, she feels like an adult to me. It feels like she's had her own, I mean, maybe because I had her so young, it feels like she's had her own, like, she's lived a whole life already, But I still have to remind myself that after my adoption, this is a child, and she deserves a soft, loving environment. And I do believe that I give that to her. But a lot of times it's really hard to find that middle ground as a mother and a caregiver, Like when is it, when is she playing in my face? And when is it that she actually needs my love? But I do believe that me and her have the kind of relationship where she can say, hey mom, I'm in pain, and I will believe her. Like that's one area that I don't ramp with, I don't play around with. When she says it, I believe her, and regardless of where we are in our mother best friend relationship, I take her to the hospital and I do what I need to do in that moment. So, but that's definitely this has been the hardest part of raising a child with sickle cell for me. And it'll probably get harder. But yeah, the teenage stage has been very rough. Yeah.
So I'm a parent of a sickle. I'm gonna be at 4, so I can tell you right now. Oh my God, oh my God, I'm sorry. You are going to go through phases, and it's a very difficult balance because I'm not trying to do whatever, but there's going to come a time where they may not like when you say what you say to them. They may not like it, but at the end of the day, you have to make sure you don't end with them, because there's a very thin line. So if my daughter is not well and she needs to go to the hospital, no holds barred. We go, we're there. But at the end of the day, teenagers are sick. And those girls busy. And sometimes it's not addressing. And I know when the guilt comes where you don't want to stress her out. But if you don't address it, it's gonna affect all her other relationships. There will be a time when she can't take mommy. There's gonna be that time where she's like, man, I'm so sick of mom, and she always doing the most and all of that. But at the end of the day, you are the person that's gonna teach her how to cope with the real world. And all the time, within the home, that's not the real world. She has to know how to cope. She has to know, hey, not everybody's gonna like you, or not, you can't respond to situations this way. So sometimes, listen, it's like it's tough love sometimes, and I have had to come to grasp with that at times I may not be the favorite
It doesn't have nothing to do with the law. But I feel that if I go do the right thing by her and she goes out into the world and is not able to manage or advocate for herself and do the right thing or deal with certain situations, we're gonna have a problem.
Mhm.
You know, for me, I have 3 kids too, and you're right.
What were we thinking? I don't know. Just kept going. I don't know.
So my son is 25. My daughter who's 6 is 20, and then I have a 16-year-old. So I have to adjust. And sometimes, let me tell you, I'm old school. I literally have to come to 10 so I don't pop up. I'll be honest. And I gotta remember, say, boy, I can't call up like I don't want to call up.
Yeah.
She's 16, but you gonna get it. They're going to, they want to get out there, they're frustrated. I want to live my life, I want to do this, I don't anybody
Man.
want to do. I want to, and you as a mom to stay careful. But for me, I have had to learn, and I'm still learning. It's hard, it's hard, but just keep an eye out, make sure she's on the right, but just as best as we can, because she's gonna have to go there.
Yeah. And she wants to go out there. Real bad. Yeah. She don't know nothing but bills are out there. That's it. Bills and stress. But yeah, they're gonna learn.
A question and answer. Any questions from the audience to the panelists here? So you can just, anybody has any other questions that they want to ask or find out anything else about how to deal with this? How to deal with caregivers and community in and around the community too. Right.
For those of us who don't know anybody, don't know much about it, what is one thing? Yeah. From each of your perspectives.
Yeah. Good question.
It's a great question.
I think for me, as a warrior for a very long time, dealing
You
with,
might get one.
my mic is off again. Hello. Hear me now?
Yes.
Much better. So I think the one thing I want everyone to know that no matter how strong we are, we need sometimes we need someone to look out for us. Because I get this thing all the time, you're strong. You're strong, you get through this. And what you see is not necessarily what's really going on inside of us. Because I'm sitting here, I don't know what's going on with me, right? So a lot of times we would really want you to know that we are going through some weird stuff. We are having a mental breakdown because our life is unpredictable. As a warrior, we don't know what tomorrow will bring. I know that everyone is sitting here. You all don't know, but we certainly don't know. Because I'm sitting here and in the next 2 minutes I could be in a crisis. So I would like everyone to know that we have real issues going on. No matter how we're looking, we're just putting the best outside. So it's not all the time you see us, we are strong. Regardless of who we're laughing, we are tearing up inside. So sometimes I always say on my page, check up on the strong ones. Because a lot of burden I care for persons who are not sick. I care a lot of burden. A lot of people call me. A lot of people keep telling me their problems. And I listen and I give my best advice, but I tell it in bed. I tell it in the hospital. Giving them advice broken. I'm giving them advice from a place of I don't even know what's going on with me later, but I don't show it. We hide pain a lot. That's all I'm saying. I don't know for the rest of warriors, but I know I can speak for some of them because they tell me the same thing.
Yeah, I was gonna say for caregivers, yeah, it's I'm gonna try not to cry because seeing your child in pain is like it's hard.
And they don't even understand just how much you hurt, but I don't think they understand.
I do.
Sorry, I do.
I do. My mom died 11 years ago. And whenever I was in a crisis, I could see the sorrow in my mom's eyes. Not that she's crying, I could see the sorrow and pain in my mom's eyes. Like she could trade places with me. And she had a lot of guilt. She had a lot of guilt. Sometimes she said to me, are you mad at me? She said, are you mad at me? And I said, why you think I'm mad at you? And she said, when you look at your other two siblings, they're well. But I know exactly. I'm not feeling it physically, but I know my mom went through a lot. And to all you caregivers, I'm telling you thanks on behalf of all the warriors because you put up with us so much. And if it's 3 o'clock, you're there. If it's 2 a.m. in the morning, you're there. We take sick at school, you are there. And
Anywhere else?
I'm just sorry that my 3 caregivers wasn't here tonight, my husband and my 2 kids, because they tolerate me the most. They are there for me 24/7. I remember before I came here, I was in Jamaica with my son and he was about 11, 12, and that little boy took on a task like a big man. He came and visited me in the hospital and while his father was here and he cared my clothes and he went home and he washed them and he came back.
We don't know what they go through, but and caring for some of these caregivers have to go through it. Let me tell you, it's not easy, and I think we need to be more open and accepting of all the warriors that we might work upon or meet, know about. These folks. But it's enlightening to hear how you guys have dealt with everything and how you're dealing with it. Sorry, did it answer your question?
Well, I also want to touch on the fact that, when you were saying like, give you grace and stuff at the same time, like my daughter, and I think it's because she is in that, I'm a teenager, I'm a baddie, she's in that stage, she doesn't want the pity. At the same time, she wants people to look at her regular, like even when I was like, you have to come to this event tonight, she's like, oh, I don't want to be like, she doesn't want the stigma attached to it, and it's like, for me, as a big person, I know like, the more you know, the more power you have, the more you can control this, the more but she's not trying to hear that. So it's very frustrating to deal with the ego of a 16-year-old, But yeah, being a caregiver has definitely been uh, the beauty and the bane of my existence. And it isn't a burden. And that's, it's not a pleasure either, but there's nowhere I would rather be than with my daughter, at that moment, But of course, seeing your child like that is just, it's hard. There's nothing worse. There's no pain that I've experienced physically worse than seeing my child like that. So
it's hard, and then I experience it on both levels because I'm a warrior and I have so many caregivers and I see what people go through and I
you have your own guilt.
but I have my own guilt because sometimes I say, am I really stopping these people from living their lives? Sometimes I feel like that. And then as a wife, I think we need to talk about, not now, but maybe the next time, talk about relationships, living with sickle cell disease.
I would love to hear about that.
That is a whole story by itself. That's hard. That is hard because being in a relationship and dealing with chronic pain every day. I did replacement, I've done a hip replacement step months ago, I'm doing another one the next 5 months from now. It takes away a lot of pleasure out of your relationship, meaning There are a lot of things I can't do with my husband. He loves to swim. I can't be in the water for too long. So I think we need to have a lot of discussion about that also.
Oh, yes, thank you guys for sharing that. It's always good for us to hear this, to get those perspective. What I would say too, in terms of the larger community, I think education is key. And then a lot of people don't know their sickle cell trait status. So really understanding how sickle cell disease comes to be about. So, you know, you inherit a trait from your parents. I think since 2002, all the states in the US test for sickle cell trait and sickle cell disease at birth. But the issue we're having is they're not relaying that information throughout. And I remember when I was like, oh, you know, I want to be a sickle cell disease doctor, I actually did pediatrics too. And every time someone would have sickle cell trait, I would add it to their medical history, and my attendings would always pull it out. They were like, yeah, I remember that. He was like, that, don't add it to the problem list. It's something you guys, yeah. And so, but then now when I think now that where I am, you know, a lot of people don't know, and they don't know how to be tested. So to be tested, you do need to get a test called hemoglobin electrophoresis. You go to your primary care doctor. I think that's really important as you do family planning. To individuals with sickle cell trait, not saying that they cannot get married, but you need to be educated on that. And then there's some other stuff that you can do with in vitro fertilization if that is a concern about whether or not you'll have a child with sickle cell disease or not. So that's what I think is most important. Yes.
What was the reason they give you for pulling it out?
They said it wasn't medically necessary. It was like you had to put, yeah, this was in Nashville, Tennessee. So I was like, oh, you know, so I'm, you know, this is a total.
Has that changed now?
I don't know. Dr. Taylor, she's a pediatrician because I'm in the adult side now.
Like a lot of stuff in healthcare
Yeah.
depends on the person.
Yeah.
And something that I think we should probably talk about now is just the diversity in healthcare. So
Yeah,
important
exactly.
To have providers that look like Dr. O and I.
Yeah.
Come from a different perspective.
Exactly.
So we have a majority healthcare provider. Sometimes, you know, they just don't get it. They don't understand.
Right.
And I like the fact that you found that hydroxyurea was a benefit to you. And I want to say that pain is having one thing, but what you're not seeing is how it's protecting your internal organs, you know, your brain, your liver, your heart. You know, Dr. O can speak more about the effects of sickle cell as you get older. But kudos to you guys for
That's the reason why my daughter, like me, decided to, I ultimately let her decide to, you know, it's your body, you're 15, 16, well, she was 15 when we started it, but it was because her hip was so swollen after a really bad crisis. The crisis had already passed, but the swelling is bad, and it was like, okay, look, at some point, this started eating away your hip. You know, you might have to get a hip replacement, and, you know, also, I was telling her, like, your organs, all these things, that we had avoided it for as long as we could.
Yeah.
And the doctor kind of let it be. We have a phenomenal doctor. I don't know if you guys know Dr. D'Agostani and Baptist in Maine, but anyways, he was kind of like letting it be like our choice for the most part. And then when we listen, it's time now. And I'm so happy that he used the tone that he did, and you know, because we listened, and it's been great. And she was scared of the medication every day because she's just scared of medicine, but it's been so life changing.
Yeah, and I'll just echo, yeah, so, you know, sickle cell disease, we have the pain crises that are very loud, but there's also silent damage. And unfortunately, a lot of our patients, as they get older, they're dying from the silent damage. So that's the strokes, that's the kidney failure, that's the heart disease, and hydroxyurea protects us from that. And looking at the data, the people who are living longer with sickle cell disease are those that are on hydroxyurea. It's to the point now that the last conference that I went to with hematologists, they said that all people who have sickle cell disease, hemoglobin SS or S beta thalassemia null, should be on hydroxyurea regardless of the number of crises they have. That's how beneficial that they find it. So yes, kudos to that.
So I have two questions, one for Dr. O and one for the parents. one for the survivors and the caregivers. One is how did you did you experience any doubt by medical professionals that your daughter wasn't initially?
Yes.
As someone who works in
That's
health,
such an odd question, and I experienced
I work-
very like I felt that so.
I work in healthcare. That's why I could ask that question. Yeah.
My daughter didn't have like a real crisis until she was like 9, 10, 11. I don't even remember the first one. It was way after she was diagnosed at birth. So I'm bringing her to this hematologist, you know, and then every like couple months, and all of a sudden it was like, oh no, I'll come back every year, I'll come back every 2 years. I'm like, well, does she have sickle cell? Because what's going on here? Because I grew up with people that had sickle cell, so this was very like not what I experienced until she hit like, you know, it actually really started to like show itself when she got COVID, which is around the same time that she also, you know, the hormones started kicking in. So who knows really what it was. But yeah, I really doubted that she had it because she didn't really have any crises. And then I remember one day we went for a bike ride, a long one, because I was like, she's fine. We've done all the activities. She doesn't have crisis. We went in the pool, and we're in the pool for hours. And I have a cousin came in the pool for 10 minutes. So I'm like, okay, no, there's no. And she has by the way, she has sickle cell beta thalassemia. And at birth, they told me she had sickle cell SS. And then all of a sudden she had beta. So I'm like, do y'all know what's going on here? Like, so then we went for this long bike ride, and that's kind of where I was like, okay, for sure. Like she had her first crisis, and then when she eventually got COVID, that's when everything kind of, you know, spiraled from there. But yeah, I definitely doubted it because, and when I looked it up, the type of sickle cell she has, that's really normal for her to not have any crisis until she's, you know, when the hormones are flaring up and stuff like that. So
I ask as a parent who's had to advocate for my son when I'm in the hospital, and I think about people who are not armed with the things I am armed with and how they deal with it, because I know how to write a strongly worded letter, believe me, but not everybody feels empowered to do that. So I wanted to know, how did you deal with that in the beginning?
I mean, I think because I already knew people that had it, and I did a ton of research when she had it. And I mean, like I said, every time I went in, I was like, are you guys sure? Are you guys? Like, we're sure. We're sure. So just knowing that, you know, the doctor is sure, and then just doing all my research, you know, so by the time that she really was having crisis and stuff like that, I was really able to like advocate because I was so educated on, you know, what she had. So.
How did you feel?
With my son. So my son was my only pregnancy. My daughter is not my biological child, but she's still my daughter. When I was pregnant with my son, I was experiencing a lot of mixed feelings because my husband didn't get tested. And we all know sometimes the male, they don't really like to go to the doctor because they just think that I've never been sick before, nothing is wrong with me, I'm fine. And he did not get tested. And right through my pregnancy, I was having a lot of feelings because I said, I've been through so much, and I would not want to carry a child in this world to experience even half of what I've been through. But anyway, I went through it. My son was 8 months when he was premature, 3 pounds. And when I came out of the hospital, my doctor called me and said, he came by and he got the, I think it was some test he did, and they found out that he just had the trait. I was so happy. It's like I was carrying like a big burden on my head because I'm saying I could not deal with this. And even before I got that he was not sick, I had to deal with complications with him being premature. And I'm saying, am I ready for this as someone who is experiencing pain every day, basically? But thanks be to God, he pulled me through out of that situation, and now he's 20 this year. So yeah, I'm happy.
Doc, I want to ask you,
Yes.
how do I work in healthcare, and how do we fix it? What do we do to fix it? Because the level of doubt is strong. But just for regular things. And
Yeah.
especially when you don't have the tools, because what I have found is that people who can't articulate for themselves, or people who are perceived as with low SES, they're discounted.
Yeah, I think it's education. I think, and, you know, it starts in medical school, it starts in residency training, and then there's refreshers too
Right.
along the way. And making that education mandatory for providers, and then also looking at some of the key outcomes, such as like when someone goes to the emergency room, it should be treated within an hour. And then really to kind of document holding the hospitals accountable. I think all those things get changed. To begin with, I think it's education, making sure that, you know, all physicians are rotating through the sickle cell disease clinics and things of that nature. Again, you know, sickle cell disease is a disease that is very popular throughout the US. Depending on where someone trains, they may not have that exposure. But I think overall, it just really has to be incorporated into medical education as well.
Questions? Oh, want to find out more?
This has been great. I think what is good about this conversation is that we continue to talk and continue to educate. Nurses and doctors aren't bad people. They just really need to be educated, as Dr. O said. You have to include it so that people can learn.
Yeah.
You know.
And one of the things that I found that were helpful at my previous hospitals is having grand rounds just like this. So grand rounds is what we have at a monthly basis, where all the medical doctors are required to come in. And a lot of times when they hear stories like this and what happened and things of that nature, that really changes their perspective too as well.
And in the Caribbean, you know, people think that it's about race. And okay, it is and it isn't. Because in the Caribbean, where a lot of people look like us, the behavior is exactly the same. It is exactly the same, in some cases worse. So it still is about, if you're in pain still, like they're just puzzled. So I'm saying this to say that the education about invisible, something that people can't see, is still very real.
And I want to say too, even just outside of the doc, like being in the hospital, it's like family members with my daughter. You're still in pain? I'm like, are you serious? Yes, she's still in pain. That's why I have to get like rude and nasty with people because yeah, she's still in pain. Leave her alone. Like, but yeah, that's especially when it's ongoing. And I'm like, and this is for life, you guys. You know, and give her grace. Give her. I mean, don't baby her, but give her grace and understanding. You know.
So I say that family. We had a family reunion in 2024 in London. And my cousin's friend was from Nigeria that came to our reunion. And he was sitting with me while I was talking to the family about it. Now, this is my mother's family. I know for sure that I got the sickle cell gene from them because my father was tested and he doesn't have sickle cell, but my mother had passed. So I say this to say, I said, listen, guys, I've lost a child. I don't want this to happen to anyone. Know your status, get tested. And he kept saying to me afterwards, your family act like they don't care. I said, they care, we love each other, but they don't think it's their problem. It's my problem. You get what I'm saying? So even the people that love you, you have to I still push it. I don't stop. Everybody that I meet, everybody that I interact with, talk, share, educate, find different ways. When I go to a training fest and I'm doing rump one shots, I'm meeting 10 nurses. I'm just saying, it doesn't work in a healthcare all the time. But when you're socializing and having a good time, you'd be surprised how many people you educate. how many patients you might, oh, I didn't know, I didn't have anybody to talk to. Keep talking, keep sharing. People don't understand, we just have to
And
educate
Andrea,
them.
I'd like to add to that. Also, when you have a child that has a sickle cell trait, I start to educate my son from a very young age. Yes, because persons used to say, "Why are you telling me all these stuff so young?" I said he needs to know. And I tell him all the while, he laughs, but I'm dead serious. I said, you meet a young lady and she has a sickle cell trait and you're in love with her, try to unlove her. I am dead serious. I said, listen, fall out of love. Fall right out of love. Because this grandma ain't gonna go through all of that. And I don't want you or anybody else to experience that. And you always laugh and say, no, mommy, I'm well aware of it. I will make it happen. You say, make sure.
I roll.
After I had my daughter, I started dating this guy very briefly about he had the trait, and I stopped talking to him. I told him, listen, I haven't stopped talking to you because of this, and I didn't talk to him after that because I already had my daughter. So I was like, no, block him. Oh my God. And now they want to block him. It sucks, but you know.
And I was like, oh my God. And then I wear a fucking check. I'm like, do you know what? I love to work, but the reason why I got, but the reason why I got she was pregnant around the same time. And she found out and her own son in the I'm very passionate, like when I see for together or young adults, get
And even telling your son so early, like I was a teenage parent, so it's never early enough in my opinion, you know, because I grew up with one of my best friends had sickle cell, and that's why I've always known about it. But because you know I'm young and I'm doing all these, I'm not worried about this, but I'm hoping that with telling my kids, you know, the reality of, you know, sharing my story and seeing what I've been through and just not, you know, just hoping that they can make better choices than you know than I did. So.
And it's funny how Zoe and I connected. I think it was through the consul general, right?
Yeah.
Oliver. Just because of sickle cell, she really didn't have the support and know a lot of people. So it's really good to have a community here. Memorial has a lot of interactions where people can come together, sessions where people can talk. Sometimes they don't show up, but they should. Just encourage. Encourage. Yeah.
You want to say? Anything else to say unless there's any more questions? I mean, this is lively for me.
Stephanie, and
I just want to make sure everybody here. This is Raising the Blood, this is a warrior, right?
yeah,
Who wrote this book? And it's available online.
she's from Jamaica and she's a teacher. And sometimes I love to get some of these just to share what warriors are doing, you know, through their journey.
Yeah. And then I'll just finish the book and then there's this the 1 minute gratitude journal. You can write what you want to share and how you're feeling, what you're going through.
So I looked up that woman on Amazon. She's a woman of color from North Carolina. And I just looked that up and bought 50 of those books and she gifted me another 50, like 6 months later. So it's for teens and for adults. But it's so important to start from a grateful place and write your feelings.
Yay!
Also online, Amazon.
She wrote that book called James for Jamaica for kids.
We have a good visit starts here, your hospital appointment and symptoms tracker.
So that's a warrior mom in Atlanta that I met. I haven't met her face to face, but we are friends. she has two boys with sickle cell that are teens. So she wrote these books, which I think are great for people that are young. And it shows you how to track your numbers, your medication, your steady state, that kind of thing. Yeah, that one is also by her.
A journal, oh, by her too. Writing out my pain, talking about my this.
Yeah. And it's just things that they can do, you know. Journaling is very good, it's very healthy, it's therapeutic. So just thought we would share.
Rich program, Sickle, health and resilience, peace, balance, and empowerment. This is memorial to the cell medical news that's been brought over this. I think you can get pamphlet, the flyer over there. It's February, started in February. Every other Wednesday of the month, education, health, medical, home, and
Yeah, I'll just say this is an embedded psychiatry program for our warriors. So a lot of our warriors deal with anxiety and depression, post-traumatic stress disorder from hospitalizations. So we are going to have a psychiatrist join our clinic 2 times a month going forward. Also having a therapist that's going to do individualized therapy too as well. So we're really making sure that mental health is at the forefront for all of our warriors. It's free and it's accessible. And like I said, the psychiatry physicians are a part of the team. So we really think this is going to be a great resource.
I'm sorry, you said twice a month?
Yes, it's going to be Wednesday. So they're going to have their appointments Wednesday mornings, every other Wednesday.
every other Wednesday.
Yes, but the individual therapy is going to start in March, and that's whenever the therapist can put people on their schedule. And we also have group therapy Tuesdays and Thursdays from 1 to 2 p.m. too as well.
Invite Andrea.
This was great. Thank you guys, this was so great. I wanted to also introduce Monique by just today. So I am in touch with her sister, Marie, and she has an organization as Starlight. Started by her mother, who also
21.
and they started the organization with Maria, which was also a health professional. So they do amazing work, get to know her and speak with her. It takes a village. Can you imagine if 100 of us are doing this work and helping people, how much we could accomplish? So just want to thank you guys, continue to talk and share with each other. And thank you again so much. Shak is 10 this year, so we would like to do 10 achievements, 10 different things throughout the year. So if you have anything you'd like to share or any ideas that we could do, I like the one about the next takes one next time. So this is definitely looking for that. I head to Jamaica in the morning. We are doing distribution for some patients in Jamaica working. So my husband is here already. Warriors down there packing and lining up. We're gonna serve over 200 patients, mandatory, everywhere in the area. So I'm looking forward to it. So thank you. And, oh yes, okay. 70713.
Ticket number 770-713. Seven, 713. Going.
I guess that's it again.
713.
Yes.
So I have 2 of them. So I met this warrior on
on TikTok. She has a spa in North Miami. And I purchased 2 certificates from her to take deliver up. Right, so that's
Number
we're
one.
gonna get them for you. And the second 770-727.
Yeah.
Somebody went to the bathroom. Nobody? All right. Another one then. 770-722. Man. This is strange. 710.
Oh, I don't see anyone.
Just say it's you.
770-726.
Where is she? Right there. You, what's the 26?
All right, awesome. Thank you. Enjoy until we wrap up. Thank you, guys.
Thank you so much.